Dear athletic directors, coaches, and training staff, thank you for joining me. My name is Dr. Daniel Kantor. I am the President Emeritus of the Florida Society of Neurology and the Vice Chair of Sports Neurology at the American Academy of Neurology. When we looked across the country at the different states and we tried to make legislation that would protect youth athletes, we had to make laws that would make things equal in different parts of states and different parts of the country. For example, in Florida, we passed legislation to protect youth athletes. We raised the level of education, we made it easier to come out of play, and then we made it a little harder to get back into play, and we started the graded return to play. A lot of people over the past decade have asked me what we can do not just for the minimum, but what we can do to really protect our youth athletes. And that's where the idea of NeuroSport was born. The idea is to give athletes a baseline evaluation. That baseline evaluation is comprehensive. It's not a baseline evaluation that's just a simple computerized neuropsychological test. In fact, in Florida, we took out the wording of computerized neuropsychological testing from our forms because we were concerned about impact testing and other sorts of testing that was marketing to schools and telling them that that would be comprehensive for concussion evaluation. We want with NeuroSport to make sure that we test all facets of the neurology of our student athletes. When a student athlete has a baseline evaluation with NeuroSport, they go through several stations. And in each station, we're testing different parts of the neurological system. And the idea is to have a true baseline so that we can understand what happens year to year, and we can understand what happens if there's an unfortunate case of a concussion. The athletes will go through stations such as QEEG, or quantitative EEG, or electroencephalogram, a brain map. They'll also have cognitive testing that will look at their memory, their attention span, and other sorts of things that have to do with how they think. We're also going to have an eye station. And in the eye station, we have a virtual reality almost headset where we look at the eye movements as well as using mules or the rapid sorting cards that comes out of NYU, New York University. We also test mobility and balance. We put the student athletes through the best testing with TEC scan as well as with tracer. And the idea is to really know how good the student's mobility is and how good really their balance is as well. We also do a comprehensive neurological history as well as a standardized neurological examination that includes rapid task switching so we have a better idea of how that student athlete is doing. The idea of this whole big picture is to have a true baseline of how that student is doing. That way, if there is a concussion and there are changes, we know what they are compared to how they were beforehand. In fact, we can come to your school and we can do the baseline evaluations. And then after a concussion, what can happen is on rehabilitation stage 4, we can put that student athlete through that comprehensive evaluation as well. And then after they've gone back to play, 6 weeks after the concussion, we can retest them to get a new baseline to understand where they are and how they are functioning. Aside from the work we're doing for concussion, we can also supply you with performance evaluations. This can give you an idea of how good or not good your student athletes are at different aspects that are important to sports. How good they're balanced, how good they are at task switching, how good they are at their eye movements. All of this can be very helpful for you in the case of a concussion, but also just in the regular course of play. Fred will talk to you more about the different kinds of options that we have available to you and how we really can help you here at NeuroSport. I invite you, if you have any questions, to please call me on my cell phone, 904-687-7879, or you can email me at dcantor@neurosportconcussion.com. My name is Daniel Kantor. I am President Emeritus of the Florida Society of Neurology. I chair the subcommittee on concussion for Florida High School Athletic Association, and I'm the Vice Chair of Neurology for the Sports Neurology section of the American Academy of Neurology. Thank you so much for joining us.